Hello, my name is Andre Ware, and today I will be discussing infectious disease management and how it improves healthcare quality in America. Infectious disease management improving healthcare quality within the U.S. healthcare system is stringently being tested by the current coronavirus pandemic. In addition, I will be using Donobedian's definition of healthcare quality to assist me in analyzing and in providing how infectious disease management improves healthcare quality through structure, process of care, and outcomes. In addition, I will define each subcategory of healthcare quality and then share how infectious disease management improves it. Let us begin with what is infectious disease management? Essentially, it is identifying foreign microbes, then determining what therapy, if any, is necessary to treat the microbes. And lastly, controlling and monitoring host reactions to the infections through treatment. Infectious disease management, improving healthcare quality through structure. According to Donobedian, structure is considered the number of locations of healthcare organizations. This includes clinics, hospitals, and other places where individuals can receive healthcare. In addition, this also includes the therapy available, as defined earlier by infectious disease management that determines what therapy is needed to treat the ailment for the most effective outcome. In order to better control infectious diseases, specifically COVID-19, the federal government, along with private and public healthcare organizations, now require additional immunization records before hiring healthcare professionals. Furthermore, the healthcare organizations, such as clinics and hospitals and long-term care facilities, are also requiring their associates to become vaccinated by a certain date or face termination. On the other hand, according to the U.S. Department of Health and Human Services, these same healthcare organizations are facing staff shortages along with difficulty maintaining and expanding hospital capacity to treat the patients. As a result, these healthcare organizations have devised particular plans to combat these shortages, such as offering bonuses, pandemic pay, and separating which healthcare professionals work with infected patients and those who continue to work with the general population. In fact, all of the aforementioned solutions have proven successful. Overall, increasing safety by requiring additional vaccinations may have decreased healthcare professionals within the healthcare organizations, but it keeps everyone safe. Infectious disease management and how it improves healthcare quality through process of care. Donobedian defines process of care as what is done to the patient. For example, immunization rates and how many patients are immunized. Additionally, once the foreign microbes have been identified, what treatment or therapy will be used to treat the patient's ailment? Infectious disease management improves healthcare quality by protecting the patient and healthcare professionals involved in the process. First, several healthcare organizations have refused to treat a patient completely if the patient is not vaccinated, which has become a precedent. For example, some patients have been denied transplants because they are not vaccinated. Moreover, transplant patients are at a higher infection risk if they are not vaccinated, according to Dr. Dipali Kumar, President-elect of the American Society of Transplantation. Second, infectious disease management suggests that therapies, also vaccines, target foreign microbes and build the body's immune system to decrease the incubation period and symptoms of any disease. Essentially, the belief is that if the healthcare professionals and patients are vaccinated, The vaccination decreases the severity of foreign microbes transmitted. For example, a December 2020 study done in France with 1,000 patients hospitalized with coronavirus found 18% of kidney transplant patients died. However, opposed to the 11% of non-transplant COVID-19 patients that did not die. Third, with any healthcare setting, with enough healthcare professionals and patients vaccinated, this also may create herd immunity. Overall, the individuals, both patient and healthcare professionals, contribute to improving healthcare by using the therapies and vaccines suggested by infectious disease management. Infectious disease management and how it improves healthcare quality through outcomes. Donobedien's parameters on defining outcomes simply means what happens to the patient. Moreover, as a result of therapy of the process, how does the therapy affect the patient? For example, are COVID-19 rates increasing or decreasing? Are infection rates increasing or decreasing? Simply put, is the therapy working? So, through the study of epidemiology, the determinants of healthcare-related episodes in human population, and it focuses on prevention and controlling healthcare problems. First, epidemiology identifies risk factors for diseases along with individuals and populations at greater risk for diseases. Second, epidemiology monitors these diseases and other health episodes over time. Third, epidemiology controls the outcomes by using the most accurate information to reduce or eradicate the diseases altogether. Overall, the study of epidemiology is one of the greatest resources of how infectious disease management improves healthcare quality within the U.S. healthcare system. So let us summarize how infectious disease management improves healthcare quality through structure, process of care, and outcomes. First, through structure, healthcare professionals will not be able to serve in any vein of the healthcare system without the appropriate therapies or vaccines. This limits the exposure to patients and to other healthcare professionals. Moreover, we have witnessed this on a federal, state, and local level of all healthcare organizations. Second, in regard to the process of care, the fact remains that patients are being refused treatments unless they have previously received therapies or vaccinations for specific diseases, which helps to increase the success rate. Third, healthcare outcomes are essential, and the study of epidemiology increases the knowledge about diseases and how they can impact the overall healthcare quality of the human population and how they best monitor and control these diseases. Overall, infectious disease management will continue to evolve, just as the diseases it identifies, monitors, and controls. Similarly, our future requires we expand our knowledge and processes and continue to establish revolutionized approaches, just as the variants we continue to face every year worldwide. Thank you so much for your time and have a great day.